Hi, my name is Kira Douglas, and today I'm going to be presenting my case study treatment plan done by me. Alright. So we're going to start out with the first slide being diagnosis and then signs and symptoms. So the diagnosis of my kid for my case study had spastic quadriplegia cerebral palsy. And his name was Josh, and he was 7 years old. And he had a lot of different signs and symptoms that I'll try to work with in the activities that we'll talk about later. But just to go over them, we've got spastic tone in all extremities. So it's relating to or affected by muscle spasms. And he also has some voluntary movement and some involuntary movement when considering the upper extremities. Josh was unable to weight bear or ambulate, so he's unable to walk anywhere like that, mostly in a wheelchair most of the time. And he also had windswept hips and a rotation of the pelvic. So his knees, whenever he was sitting in a wheelchair, would kind of go more towards the left or towards the right instead of just straight ahead, which is what windswept hips are. And so we work on that in some activities. And then he also had some severe wrist contractures and Volkmann's contracture. He drools excessively and is nonverbal but can understand some simple conversation here or there. And the cognitive functioning of Josh was about the age of like a 4-year-old, so he was a couple years behind. And his feeding status was he's unable to feed himself right now. And for leisure, he is unable to operate household items such as like the TV, the lights, or remote. And he will become restricted in the ability to participate in community activities. So if he were to go on a field trip to say the zoo or shopping or anything like that, he'd be very restricted in his ability to do that. And for typing, Josh types very slowly with just one finger. And for communicating, Josh uses a simple communicating board with a limited number of pictures. So that's definitely something that we want to work on, is being able to completely use that communicating device and eventually upgrade to a bigger one if that is able to. And Josh is fed by a staff member at his group home or by his mother, so he's unable to feed himself and is completely dependent in that. Okay, sorry. Alright, for client history, I didn't get too much for client history in my case study, but I did get that Josh lives in a group home and he is 7 years old. I believe he lives in a cerebral palsy group home with a bunch of other boys and girls with cerebral palsy to improve their care that they get. And of course, he sees his mother as well, as his mother helps out with his feeding and other things like that. Alright, and as for my 45-minute treatment plan, so to start off my treatment plan, we're going to do a warm-up with flashcards. And the client is just going to flip through some flashcards of different animals, objects, colors, words, just a bunch of different things that is a pretty low level, that he would be familiar with. And then he's going to name the object with his communicating device as best as he can, which I do know that his communicating device is pretty limited. And of course, he can get whenever he needs assistance, minimal assistance can be given. And this will improve the client's ability to use his communicating device when talking about familiar items, to become more independent with talking. And for activity number 1, I called it Reach for the Sky. And for that first warm-up, we can do that for about 5 minutes. And for Reach for the Sky is also going to be 5 minutes. It's activity number 1. The client will lie supine with his hips and knees bent. Therapist will support his legs to ensure proper position. So it's like laying on a trampoline, and the client will be right in front of the therapist and just holding his knees and legs and keeping them in the bent position. Client will reach up, extending his arm as much as he can to hit the ball out of the therapist's hands that she's holding above his stomach. And this will improve his voluntary movement of his upper extremities to go ahead and reach that ball and hit it out of her hand. And then along with the hand-eye coordination to be able to see where the ball is and direct his hand to where it needs to go. Alright, and then continuing on, we've got activity number 2, which is just called Reach. This activity is also just going to be another 5-minute activity. The client will lie supine on the trampoline and reach his hands above his head as best as he can and hold that for about 5 seconds. This will improve the child's upper extremity range of motion. So of course, he might not be able to reach all the way above his head, just trying to get his shoulders to reach his ears as best as he can to really improve that voluntary movement and being able to reach and extending his arms as well. All right, for activity number 3, it's just called sit and relax, and the client's going to sit in a supportive chair with hips and knees and ankles all bent to 90 degrees. This is such as like a chair with cushioning around to keep his knees straight ahead and no windswept motion in order to improve that proper position. While sitting, he will reach and separate colorful balls and foam balls, and then of course if he wasn't wanting to do that, there really any activity that he can do while sitting that he's interested in is definitely fine. And he will tolerate the sitting position for about 7 minutes, and then it'll improve his windswept hips along with overall proper sitting position. And then playing with the balls could also improve his palmar grasp while reaching for them and using his voluntary upper extremities to grab those balls. And also distracting him and keeping him busy while sitting in that chair. It's not fun to just sit for 7 minutes, so that'll be more engaging for him while working on his palmar grips and overall knowledge of colors. All right, and then for this next one, I did 2 more, but they're both 7 minutes, and I just had the child can pick between the 2, or if he's just completely not interested in one, go ahead and pick the other one. Just have a little bit of option. So the client can pick activity number 4, which involves just drawing, and the client will free draw a picture of any kind, anything he likes, any flower. He can use multiple colors or just one color or anything he likes. And he's just going to use a thicker marker to improve his fine motor skills so he can really grasp onto the thicker handle of the marker. And then of course the client can use a handcuff to help him hold onto that marker if needed to be able to draw a picture as best as he can. And activity number 5 is called spoonful, and the client will use a big kitchen spoon to scoop cotton balls from one bowl to another. And this will improve the fine motor skills of holding a spoon the way you would if you were to be eating like cereal or soup or anything like that. The cotton balls are light and have no resistance against the spoon, so it won't make the spoon any heavier. It's really just working on keeping that position of the hand to hold that. And then of course he can use a handcuff again if that is needed, and minimal to moderate assistance as needed. Alright, and for activity number 6 is just called standing time. This one is also 7 minutes long, and I decided to make it so we would do the sitting time inside the sitting aid, and then do the 2 fun activities, and then the standing time to make a little bit of a break of just sitting in the proper position, which can be uncomfortable for doing at long periods of time. Client will spend about 7 minutes in the standing aid to improve weight bearing and extension of the lower extremities. Therapist will talk and play with the patient for about 7 minutes to keep the patient entertained. Of course, we don't want to just have the patient sitting there doing nothing. We can talk, we can play another card game, or just really anything the patient is interested in, just to keep him engaged. Alright, and for activity number 7 is prom, and it's just passive range of motion. And the client will lay on a trampoline, and the therapist will practice passive range of motion on the legs and arms as the client can tolerate. This will help improve the range of motion for the child. So just kind of like a cool down to like stretch all the muscles out and just really get them moving before the client leaves for the session. Alright, and that one's about 9 minutes long, so that totals about a 45-minute treatment plan. Alright, and then we got my home program. I'm just going to come out and come back over here. So I got Josh's home program. This is the home program that the parent or caregiver can take home and work on a couple of these in between sessions just to ensure learning is being made and continue working on many different activities. So we got the coloring with a thick marker to improve fine motor skills. Got lying supine while reaching above the head for toys. That we'll work on some voluntary movement of the upper extremities, along with engaging in play and leisure activities. So just as much as Josh can to obviously engage with the other kids and play and just have fun whenever he can. We've also got practice passive range of motion again. Of course, it's something easy to do with a parent. Just move those arms and legs when you can. Sitting cooped up in a chair all day is not fun. And then using a communicating device for just 1 hour a day. Of course, this is negotiable. You can break it up or do a little bit less or a little bit longer if you do find time to do that. And then wearing wrist splints for 1 hour, and then that also can be broken up if needed, but it's best if it stays in the 1 hour. And sit in a proper sitting position, like at a table, with the knees, hips, and ankles all bent at 90 degrees while being supported from the back for 1 hour a day, whether that's at eating time or craft time or just anything like that. And then I also put a little can't wait to see you next week encouragement. I'm going to go right back to the PowerPoint. And then lastly, for discharge recommendations, once Josh is discharged from the group home, it would be best if he continues to visit outpatient therapy 5 times a week at an OT clinic, so for 1 to 2 hours, just to work on range of motion, voluntary movement, communicating device, all the things we talked about above. So thank you for listening, and I hope you have a great day.